Hi, I'm Al from the London Eye Centre medical team. There are 4 focusing problems that may make somebody need to wear corrective lenses or to consider laser eye surgery. The most common reason is myopia, or nearsightedness. This means you can see up close without corrective lenses, but things in the distance are out of focus.
Myopia is short-sightedness, and basically what happens is that the length of the eye is too long for the curvature of the front of the eye, and so the light comes into focus in front of the retina. If you're closer, then things get better. So in short-sightedness, the closer something is, the more clear it is. The further away it is, the more fuzzy it gets. So this is typically what we see in sort of young healthy people. They're a bit short-sighted. They squint to see better for the distance, but they can read fine without glasses.
The opposite of myopia is hyperopia, or farsightedness. While almost all of us are born farsighted, most of us grow out of it, never even knowing we had it.
Individuals who are hyperopic often have very good vision in their younger years, but as they get older, the first thing they begin to have difficulty with is reading, and then later distance. And then the same process would apply. They need to have a pair of spectacles, not only to focus distance, but also to focus it near.
This is different than presbyopia, that is simply the eye's loss of adjustable focus.
Presbyopia very nicely means old eyes, and presbyopia is completely different because it's a lens problem. And so from the day you're born, the lens of the eye keeps putting down layers like an onion, gets bigger and stiffer. And typically in your 40s, that lens gets stiff enough that you can't bend it to focus. So now it's perfectly clear for distance, but the closer something becomes, the more out of focus it becomes. And that's why people get reading glasses.
The last focusing problem we will discuss is astigmatism. This means the eye has more than one focus point.
Astigmatism basically means that the front of the eye, the cornea or the lens, instead of being perfectly round like a soccer ball, is egg-shaped, it's elliptical. And so what it does is it brings light into focus differently based on whether it's vertical or horizontal. And so it basically gives you blur at all distances. And you can have astigmatism in association with short-sightedness, myopia, or in association with hyperopia. At London Eye Centre, we have the laser technology to take care of all of those problems, either in combination or separately, depending on what you need done.
There is also an option to correct presbyopia by leaving one eye slightly nearsighted while the other eye is set for perfect distance vision. This is called monovision or blended vision, and it's a good option for patients over 40, especially those who do a lot of computer work or office work. We'll discuss it and show you what it looks like when you come in for your consultation, especially if you're in the right age group.